Okay, thank you. Okay. So I'm just going to start just to set the scene on the context of the NCHA data, and then Debbie will run through the actual data itself. But before I get started, we're just out of convocation season, and one of the great pleasures of my job is that I attend every single convocation ceremony, which in June is 8. And so And an observation from the nursing convocation ceremony that I really wanted to share with you. I know some of you were at that ceremony, but when your dean, Diane Tapp, got up to say a few words for the graduating class, she started her opening statement with, I'm Diane Tapp, I'm very proud to be the Dean of Nursing. And at that point, there was spontaneous applause from the students. And I just had to share that with you, because if you weren't there and you didn't see it, it was really quite remarkable. And I think it says something about the student group. And then at the end of the ceremony, there was also acknowledgement for Nili Hasanova, who won the President's Award. Fantastic achievement. And as Nili was announced as the President's Award, and I said a few words about her achievements, the graduating class of nursing all stood up and gave a standing ovation for Nili. That has never happened with any other President's Award winner. And again, that says something about the nursing community of students. And I think it is a community. It's obviously, you're doing great work, I think, in terms of getting that collaborative spirit and identifying the group.
I was so proud at convocation dinner that the following night. I asked the students, what was that energy about? Because it was really, you could feel it. And they said, we promised each other we were going to clap for every nursing graduate as they crossed the stage.
And they did.
Together.
Yeah.
And they were pretty remarkable.
It was remarkable, and as I say, you just need to know that it was very, very impressive with regard to the nursing students. Anyway, now we'll shift into I think it's relevant to what we're talking about with regard to the health and well-being of your students. And we are seeing a little bit of a trend shift, because student success, who's responsible for student success? So we have a student success centre. In fact, every university in Canada, college, has a student success centre. But it's not the responsibility necessarily of a student success centre that you pass students over there to help them be successful in their programs. The faculties play really critical roles in student success, and therefore, by understanding some of the barriers and challenges and context of every student, we can do a better job of supporting student success. So with regard to the data that we're going to present today, it is the National College Health Assessment data, but we should also be taking into account the NESI data, the National the Student Experience Survey. The data will be coming to us in August from this year's survey. You will get faculty level data for that. So we've got the NCHA data, we've got the NESI data. We have some data, even though it's a smaller pool, for international students in nursing, and so on. So each and every data set that we get for our students, we need to look at it holistically to understand how we can support students at the faculty level. And we're more than happy to work with the Faculty of Nursing to provide you with that. So with regard to the objectives of our presentation this morning is to really just look at the, try and understand the current health behaviours and perceptions of the university population as a whole, but also drilling down to nursing students. And we can also compare the 2013 data with the 2016. So are there any trends that we can see? I mean, with two data sets, it's actually difficult to set a trend, but we can, make some assumptions based on where we are. And then we are going to look at how we can use that with regard to informing service and program development, and where maybe there are some gaps, maybe where you can look at new initiatives to achieve some better success in that. So the National College Health Assessment, the NCHA data, it's used widespread across Canada, and in fact part of the provincial funding requirements, we receive money for mental health and addictions funding from the province of Alberta. One of the requirements was that we actually participate in the NCHA data. So that means we, they can look at comparisons across the province, and then nationally we can look at trends as well. Institutions are not identified in those analyses, but nevertheless, they're benchmarks from which we can do comparisons. So we are looking at 2013 and 2016, but just perhaps to put a cautionary measure when looking at those trends, that the population dynamics, the demographic is a little bit different from 2013 to 2016. So we have slightly more graduate students participating in the 2016. And of course we know undergrads and graduate students have different needs and context and so on. So we have to be very cautious about treating and looking at the difference between 13 and 16. So why we do it, it gives us a baseline data from which we can look at trends over the years. So we will be actually doing this on a 3-year cycle. And helps us inform service development, both in the faculties, but also central units like the Wellness Centre, Student Success Centre, and so on, and that we can compare with our data with, and what we're going to do this morning is share with you nursing student data, comparing it with the UC population as a whole, and then looking at some national, provincial and national trends. And again, we have to take into account some of the campus-wide initiatives and also the research that's going on within the institution as well in these areas. So a significant amount of work going on into mental health issues of post-secondary students right across the campus, both in Department of Psychology, I know there's some in nursing, some in the medical incoming School of Medicine and so on. So we want to try and use those researchers to help us understand the data better and make meaning of it. The data, it doesn't speak for itself, and so we need to have people who are familiar with the students providing that data to help us understand what they actually mean. One of the challenges is that it's entirely numerical data. There isn't any qualitative data assigned to this. There is in some of the other surveys that we do, and we know that qualitative data is actually sometimes more helpful. So I know Debbie has been advocating for us to get some more qualitative data to understand the context. So Debbie, is there anything you want to add to this slide as we transition to the actual data?
The other thing I might mention is if you're curious to see how we compare nationally on all the questions and also with our Alberta post-secondary comparators, all of this information is public by the provincial and national comparators, not by individual institution, on the Healthy Campus Alberta site. So it's literally www.healthycampusalberta.ca. Which you might want to look at anyway. You may wish to join that community of practice. Jackie was there at our summit last week. But if you're really interested in data, there's some interesting stuff there.
Okay, so we're going to do a switch now.
Yeah, we are. Okay. This is a fairly small data set. There was 50 students that responded. What happens is it's a random sample sent to 5,000 students on our Calgary campuses, so not Qatar, not distance learning or people on group study or Con Ed. 18 years of age and older. We had a 20.1% response rate. Really excited we got over that 20. And but I will say that, and you'll see this as we go through, the nursing data, with a couple of exceptions, is actually fairly representative of the University of Calgary data. And the University of Calgary data is not that far off from the Canadian data. So we do know that the kinds of things we're experiencing in our individual institutions around wellness generally is same kinds of issues in our sister institutions. Whoops. This gives you an idea of the split of respondents. Susan mentioned our broad study had more graduate students responding than in 2013. The nursing subsample was a little less in our graduate students. It's 21% within the full institution, and a bit smaller in terms of Aboriginal and international as well compared to the campus data. So when you're doing your comparisons, as you see the slides with full campus data, a couple of things to remember is the sample's different, but also the University of Calgary data includes nursing. Right? It was not possible to separate. It's a huge data set, and I should mention too, Diane requested the whole data set, which we finally got to her yesterday or the day before. So if you're interested in that, because what we're showing here is mostly around the topics of mental health and addictions, but there's everything from nutrition to physical activity level. There's quite a few other dimensions that are measured. Yeah?
I have a question. Was it students in our BN program that were sampled, or did we also have students in our master's? Because
yes,
some of our students in our undergrad have graduate degrees already.
So they would have classified themselves as what their status is in their current program.
Okay, so they were undergraduate.
And graduate.
So it was
Yeah.
mixed.
Yeah. So the registrar's office, the office of the registrar, just did a random sample, literally, that included graduate, undergraduate. Okay. Let's take a look at our next one. So, summary, general health, pretty good for nursing students. 94% is something you'd want your entire population to aspire to. And this is actually higher than in 2013, which was 85%. Not a statistically significant difference, but if we're trending, and hopefully that's what's happening, it's looking pretty good. So the only skill testing question I'm going to give you is this one. What do you think is the biggest contributor to poor academic performance? Yeah. C, you think anxiety. Anyone else? Stress. Yeah. It is. Isn't that cool? I did not do that, but it is stress. And it is campus-wide, and it is across the country as well. So now we'll just drill down a bit into individual questions. So this next one is on academic wellness. And on these dimensions, first I'll show you a slide that compares the 2016 nursing data to the full campus data, and then the next slide is 2013 nursing compared to 2016 nursing. So you see two slides on the same question. So you'll see when the yellow is higher, it's a little bit, it indicates a little bit higher than the broader sample. None of them are statistically significant. And what the question was in the last 12 months, have any of these factors, and there's a part 2, affected your academic performance? And affecting academic performance meant disruption in thesis work, withdrawal, decrease of a full letter grade in a major assignment or project, or received an incomplete or dropped a course. So it's significant definition in terms of academic performance. So you'll see nursing students a little bit more experiencing stress, and the rest are pretty close, but even the stress one is not statistically significant. So looking at these part one. Here's the, whoopsie, I'm sorry, did I already? Okay, I think we're just missing a slide. I'll just speak to it. The 2013 versus 2016 difference, they're actually, in 2013 it was 39%, so the stress has gone up in the respondents from nursing. The rest are pretty much the same. Depression also went up from 10% to 24%. Within a sample of 50, and again, not statistically significant, so, but just interesting. A general question in terms of academic and career wellness, again within the last 12 months, how many respondents found academics traumatic or difficult to handle? Or career-related issues traumatic or difficult to handle? No significant differences with non-nursing students, although non-nursing was a little lower, 57%, and career was 35%, so career was actually higher. And I would suspect that in a professional degree program, career concerns may not be as high as within faculties like arts, for example. Financial wellness. So 34% found finances very difficult to handle. The general population was about the same. 2013 was 24.5%. And Canada as a whole was 40%. So concern about finances compared to 3 years previous is higher. And look at the economy generally with also higher concern. Questions on, I'm sure I just pressed something, there we go, on emotional wellness. So this is on intimate relationships being traumatic or very difficult to handle, so 38%. And in terms of identifying an emotionally abusive relationship, 16%. Pretty much the same for the full campus. Compared to 2013, it was 29% for difficult to handle relationships, and 10% for emotionally abusive relationships. So this question was, and there's a series of them, asking respondents whether they felt these things during the past 12 months. And similar to you mentioned stress and anxiety were your guesses as to very high areas of concern. Not surprising, you see the highest ones being feeling overwhelmed or exhausted, and pretty close in terms of the full campus comparators. I mean, some of these to me are very sad, like hopeless, very lonely. Those are concerning to me, and even within small faculties that are so focused on creating a community, it's not that much different than the full campus. Some more emotional wellness questions and the first one is actually so depressed it was difficult to function. So nursing a bit higher there, but about the same in terms of anxiety, anger. Higher in seriously considered suicide. That's 18% of 50 respondents. Attempts, 2%. And one of the things that I always say, because of a response Susan and I got in a presentation in 2013. Somebody said, oh, 2%. So 2013, attempted suicide was 1.8, and somebody said, oh, that's really low. We shouldn't worry about that.
That's one person.
Yeah, you know, one person is too many. There is, none of those differences are statistically significant. Let's just see if this one is here. Yeah, okay. This one is nursing versus non-nursing for overall level of stress. So there is, there's more people, I think, sitting here a little bit than there was in 2013. And sorry, I have to actually look at the numbers because I don't want to get it wrong. Oh, sorry, I don't actually have it. But we are noticing there's more people compared to 2013, not statistically significant, but more people clustering here than there was 3 years previous. %, saying happy almost every day during the past month. I think it would be nice if that was a little higher. And it's lower than it was in 2013. In 2013, it was 82% for nursing students. That is that is a statistically significant decrease. Non-nursing students in 2016, it was 62%, which is pretty close. The next slide is social and cultural awareness. So there was a series of questions. So did you feel you had warm and trusting relationships? 59% of nursing students answered affirmatively. Your life having a sense of direction, 45%. Good at managing daily responsibilities, 49%. The biggest difference compared to the 2013 data set was around sense of direction. In 2013, it was 71%. That's a statistically significant drop to 45. The warm and trusting relationships, it was 76, also a decrease, and managing responsibilities in daily life was 58%. Those two aren't statistically significant, but the middle one is. Yeah.
I'm just, maybe you said it and I missed it. What was the sample size for 2013 for nursing subset? There was 50 for this one.
I would have to actually go back. I don't think that's written here. I've done so many presentations, I don't trust myself to answer that. I think it was about the same, but I can get that. When I send the slides, I'll put a note on there.
You know, Anne, I understood her questionnaire on marriage in the 50s. She asked people to respond to whether they had a loving marriage, and she was thinking she was going to write this epic thing about American marriages. And what ultimately happened were only the very pissed off marriages responded by saying, I really don't like my marriage. This does not take away from the importance of the numbers, but even though it's a random sample, I would sense people who are feeling the pain are more inclined to want to share and articulate that pain than someone who goes, it's good, I'm good, I don't need to tell you that because I'm feeling it. So I don't think this is skewed results. I think it's a context of the pain involved in the sample group. I just wonder, because my first number you gave was 94% felt their health was good, very good, or excellent. And then you break that down into these numbers, and I find
and
not matching.
And that's I mean, Susan's comment before about not having qualitative comments, and you know, the data is really rich, but alone, I mean, you almost have to engage in focus groups, and we've done that with some groups of students. One of the things we did check was how many of the people who responded left questions blank. It was really, really low, so it didn't affect, so, because one of my thoughts was, well, maybe only 4 answered that, the 4 really pissed off students.
Well, we only have, the word pissed off is relative, but we only have ballpark 800 students.
Yeah.
So if you get a random sample, I don't, did you send out to 200? I'm curious. And of that, only 50 responded, so we're going 800, 200.
Yeah. And because, we don't see who it gets sent to, we only see who responded. So I don't know how many were in that sample of 5,000. Was there another hand at the back? No? Yeah?
There is one here. I'm Karen Denzi. So
Hi, Karen.
I think that between 2013 and 2016, with all the media and the awareness and the legislation and the focus and the program efforts that are increasing the awareness of addictions and mental illness and psychosocial distress and whatever, how much of the difference between 13 and 16 are actually perhaps due to a willingness to report.
Absolutely.
Because people are more aware and more,
Yeah.
perhaps more willing to report rather than just, suck it up. So I think there's that piece, but Karen's point around the selection bias, I think is really important in interpreting these results.
Yeah. I mean, this is one thing to look at. Yeah.
If there's one other thing I was going to say, there's always things in the context that are really real too, right? So when I think of the stresses that are different for our students between 2013 and 2016, just the introduction of the NCLEX exam. Like we see the student angst around that is enormous, and it's starting to fade. We've got 2 years experience now with students writing that as their licensure exam. That was huge for students. So I think there's very real things happening out there as well that influence.
Yeah, and Karen, I really appreciate your comment about as stigma is reduced, people are reporting. And Susan and I were in a Canadian Student Services conference last week, and across the country, people said, it looks, if that was the only thing you were looking at, you go, oh my gosh, by dealing with this more openly, we've made it worse, which of course we know is not the case. You give people permission to speak. It's even our supposition that with the launch of the sexual violence strategy, we'll get more people reporting, not because I expect in 2017 there's more incidents. So we are really, really aware of that. Hopefully, I don't know, 6 years from now, it starts to level off a bit, but that'll be interesting to see. So physical wellness is the next one, and the question is asking them respondents to reflect on the last 7 days. This one is particularly on sleep. Did you get enough sleep to feel rested in the morning? And even in the campus-wide data, there's a general trend, not statistically significant, but there looks like there could be a trend to people reporting worse sleep. So, yeah, people aren't sleeping enough. Next time we'll survey the faculty. Yeah, I know. I'm not telling you where I would go either. Yeah. So 42% dragged out, tired, or sleepy on 4 or more days in the past week.
We start our classes at 7 a.m. It's clinical.
Yeah.
It's theory.
Yep.
Yeah, we are aware of that.
Yeah, and it was 38% in 2013, so it's pretty consistent with. The next, there was a series of questions, we just pulled out a few, but on alcohol use. So basically, we're looking at binge drinking. This question, I can't help but look at Jackie because we've talked about this is one of the things we've talked about. Yeah. So 28% drinking 5 or more drinks. Last time we ran in 2013, it was 29%, so it's about the same. And the non-nursing students is 31%, so pretty consistent. There is a series of questions about, and how many times did you drive after this, or do something you regretted, engaged in physical abuse. I mean, there's some interesting questions that follow that as well. But we do know, and this is a big topic, student service-wise across Canada, is we have not yet figured out the right kind of programming around harm reduction, period, whether it's alcohol or drugs. And although there's some great research going on, I think we're close to figuring that out. This is on diagnoses in the last 12 months, asking respondents whether they were diagnosed or treated for these. Can you read them okay at the back? Yes. So higher in the nursing sample for anxiety, depression, and panic attacks. The only one that was statistically significant was the panic attacks. And anxiety, sorry. Anxiety as well.
How many of those were comorbid, did you ask that?
There is, yeah, you can do that breakdown. I don't have a slide on it. I have it in my head. About comorbid, the question, yeah. You'd think there'd be a number that are like that. In 2013, the anxiety as a diagnosis was 9%. So that one's gone up quite high. That is statistically significant. This one is I like because you get a sense of people getting assistance. So the first one is, have you seen a counselor, therapist, psychologist? And then the last one is actually someone based on your campus. So it could be higher, but it does seem that generally speaking, nurses are seeking help. I'm not surprised on the University of Health, especially once you start thinking about students in clinical, like they're more likely. And I don't know, maybe there's other reasons for that. It's not statistically significant, however. Other medical provider includes physician, nurse practitioner as samples. This tells us, are we giving people the information they want? Because one of the things that's changed, because I'm old, since when I was in school is, students don't generally want printed material. This tells me that nursing students are actually getting information. So much higher in terms of internet and computer games, higher with relationship, not surprising, I guess, sleep, STI, stress, like everything is higher than the broader campus response. There's a significant and statistically significant in stress reduction compared to 2013. So I don't know what you've done in terms of providing information, and that's, it's from the whole campus, but obviously your home faculty is a great source of that information, but students are feeling they're getting the information they need. And we're coming to a close here, but here's the other topics I mentioned that will be in that full data set, which those of you having trouble sleeping, you could read it because it's quite a few pages. But there's more information on substance abuse and compare, how you estimate your peers are using illegal substances versus your sense of whether you are, which hasn't particularly changed. And I already mentioned the information that's available online. So I thought I was running out of time, and I felt like I started to speak faster. But do you have questions for Susan and I? Yeah.
So what are the next steps then for you after receiving this data?
So our student at risk team and our health promotion team get together, and from the data determine priorities, and we also are working in collaboration with the mental health strategy implementation. So for instance, the way we distribute information was an initial look. This is happening actually right now, the priority determination. But definitely substance use and harm reduction we could tell right away was high. Sexual violence as well was one that, and we also knew that we didn't have a policy previously, and now that there's a policy, we need to be more proactive in responding to that anyway. And looking at the services we offer in the Wellness Center for Indigenous students, and trying to focus on examining our cultural appropriateness of our provision.
Can I just follow up a little
Yeah.
bit, Debbie, in terms of, because this data obviously, it's telling us something. It doesn't necessarily say that, we haven't been doing anything in the last, 5, 10, 15 years. And so there is quite a lot of programming already existing and initiatives looking at some of these issues, particularly with alcohol harm reduction, for example, also with stress and anxiety and student success and dropping out with our early alert system. So what we have is we have all these initiatives going on in the institution that collect metrics with regard to the success of some of the interventions that they're doing. And this data actually helps inform these central sorts of initiatives, as well as coming to a faculty and looking at what impacts there are in the cohort. And so, as I say, it's not, for some of these initiatives, it's not going to change that significantly the direction that those have been going in, but it is that long-term monitoring, those long-term data sets, which are really very important to us. But it does highlight also where there possibly are some gaps in our provision with regard to supports both centrally and in the faculties.
Well, it's just, I was thinking about when they legalize marijuana,
Mm-hmm.
and we know students use marijuana
Yeah?
now. Will there be a plan for marijuana use reduction? Because it was just, I was reminiscing back 25 years ago, the 29% of students drinking more than 5 drinks
Yeah.
a week.
No
No comment,
Yeah.
but it was that was the drug of choice back
Yeah.
in the early 90s. So the question, well, for us who couldn't afford anything else, but just saying. But I'm saying that marijuana use, when
Yeah.
it becomes legalized,
Totally.
and it's very different for nursing, right? They can't be in clinical with
Yeah?
THC in their system. They can't. And so my question is for the university, what will there be in terms of marijuana use reduction?
So with regard to the marijuana piece, we have got a small working group currently looking at that. One of the challenges, certainly from, and we have legal involved in that too, is that we currently don't know what that legislation, and so we're looking at the legal stuff first. The legislation is going to look like either federally or provincially, and we need to, and so there's a bit of cautiousness of waiting. We are looking at what other institutions are doing. Every other institution in Canada is getting ready, they're mobilizing resources, they're mobilizing their thinking. We've had CBC come and ask us well, what if there's a bake sale and people, you know, and then they bring them into class. And so, yeah, I mean, I mean, that's a good question. You know, we actually don't have the answers to that yet. So we are going to, you know, and currently obviously students with accommodations are already using it on campus and with under medical certification and so on. But lots and lots of questions for us. As I say, we are connecting with other institutions. We are waiting a little bit until we get what the legislation is like. And then we'll react as a policy for the institution. However, we then put that aside because then we need to look at the health and well-being of our students and also faculty and staff. This is not going to be simply a student issue. This is going to be community-wide, and we do need to have supports in both our student wellness and in our staff wellness to be able to operationalize any legislation and our own policy. But at the moment, it's still a little bit of a it shouldn't be a mystery because, you know, I mean, you'll be familiar with the research and the impact, particularly on developing brains and so on. But it's still a bit of a mystery what every post-secondary is going to do with regard to the response. So, yeah.
Yeah, and I think Deb and I have talked about this. There's a lot of focus on the binge drinking and the alcohol, but I think we have to be really careful if we overemphasize that and not again get to the marijuana issue, because there's lots of research about perceived risk versus as the perceived risk is low, the use is going up as well too. So I think we would do such a disservice if we're just focusing on one and not the other.
So I had a conversation with the director of the mental health strategy this morning, Andrew Zito, who's dead keen to include the cannabis and the harm reduction with cannabis. We're working nationally with the Canadian Centre for Addictions and mental health, and they want to keep it separate. So that is not an area that they want to focus on the alcohol. They feel that the alcohol currently is such a harmful factor in people's life, particularly in post-secondaries. They've done a lot of work leading up to where we are now. They want to keep it separate. And so Andrew, you know, so we had a conversation this morning. So it is going to sneak in somewhere, and yeah.
Because I would argue that the majority of students are doing the other,
Yeah.
not the alcohol.
Yeah. Yeah.
Yeah.
It's ironic because of the stress and anxiety,
Yeah.
bar graph is so high, and it keeps me going,
But you know, it's for me, it's been an interesting because, you know, we allow the accommodations and many accommodations are to help with stress and anxiety. And so I'm thinking, well, what sort of message is this sending to those, you know, who use alcohol for coping strategies for stress and anxiety? Then, you know, now it's legal. Well, this is shown to be helpful for anxiety. Is it now going to divert that route? So yeah, I mean, it's interesting. But there are things happening behind the scenes, but it's still a little bit of a mystery.
Thank you for being
Yeah.
Yeah. Diane?
I was going to say, one of the things that I think has been fantastic about the mental health strategy across campus is really kind of highlighting and foregrounding lots of different kinds of initiatives that are already underway or have been underway over time. And I'm curious from your experience at the faculty level if there's any particular student-led initiatives or faculty-led initiatives that you think are just, you know, absolutely top-notch that we might look at as models for some of the issues that we've seen in our
Well, stay tuned because one of the subcommittees of the implementation committee is looking at evaluation, and we have 3 students working this summer. And what we did is we took all the recommendations and prioritized them, short, medium, long term, and came up with a number of programs that were directly related to all of the initiatives. There was 84. And we're going through each of those programs and finding out how they're being evaluated. And part of this is because we are obligated as a university through our mental health and addictions funding through advanced education and now Alberta Health to report on metrics. And actually, we're doing a pretty good job on that in terms of of a lot of measures from resiliency to counseling outcomes. So we're going to do that, see who uses what, and then also so end up with a logic model, also doing a lit review, and then a toolkit that can be used. I would say that I've really noticed the rise of peer support, and we know that peer support is very effective, and that many people are more likely to go to a natural helper, somebody they identify as a natural helper, than they are to seek a professional. So the more we can have things like bystander intervention or student groups, and often nursing students as community projects, and their community nursing class will develop initiatives like this. So, I think that's the key, because if all you do is hire professionals to see people one-on-one talk therapy for an hour, you're doomed forever. But creating this movement across campus, and also integrating in the classroom, doing some great work with Taylor Institute on how to integrate mental health concepts within the classroom, and in training and orienting new faculty. What Andrew says as he goes from consulting across Canada at various campuses is that our strategy and our actual implementation of it is way beyond other institutions. So yeah, I'm like you, I'm really proud of that strategy.
And maybe just to follow up on, centrally we have the Thrive Early Alert system, which highlights students who are academically at risk. So hopefully you're aware of this. It uses the D2L gradebook, and where you've got a student, a dip in their baseline performance, it triggers an alert to a central office. It does rely on faculties and instructors using the D2L gradebook. And also there can be reporting through that system without a consistent dip in grades also. So instructors professors can report in through that system where academic performance is seen to be suffering, and they're concerned about the students. So, and I would say in terms of the most effective programs, I think the most effective programs is where we all work together in terms of the faculty's work with some of the central units in providing that holistic support. But again, we'd be very keen to see some faculty-based initiatives also, because there is a very strong identity, I think, particularly in nursing, where these sorts of programs could be very successful.
Just a comment and a follow-up to that, Susan, thank you. But typically, many of the programs have multiple components.
Mm-hmm.
And I think one of the biggest challenges, and probably might be the most helpful, is to really understand which components work best for which students in which context, which is really complicated. But just to say, okay, well, this program is great, but there may be some particular components that work much better in a specific population. Say people who are new to Canada, or who are new to post-secondary or whatever. So it's the complexity, it's untangling those pieces, I think that's important. The other thing is I'd love to see a cost-benefit analysis for the response to the marijuana legislation. How much is this costing us to respond to this legislation? And where else, could we put more money into alcohol? Binge drinking, because fetal alcohol spectrum disorder is a very big problem in a female-dominated profession. There are going to be this is going to generate lots of revenue for the government, and so we need to be proactive in thinking about those people providing services need to have access to some of these tax dollars that the legislation of cannabis is going to bring to the country. Quite honestly, I think it may follow the path of the gambling.
Yeah.
Work is my suspicion.
Possibly, yeah, possibly. You know, but it's interesting when you talk about, you know, populations that we perceive to be of need, and Debbie in counselling, they've tried some group sessions on things that you think nobody would turn up to, and they have.
Social
Yeah.
anxiety,
So-
one of the best attended groups.
Yeah, in a group setting, you know, because we said, you know, nobody's gonna turn up to a social anxiety group, and they did. But isn't that fantastic? And so, you know, I think one of the best things that we've done this year is about reducing the stigma and about people feeling comfortable to attend social anxiety. And so talking about these issues really important. And if I can just share a little bit with a very tragic situation that we had recently. And so this year we had, and I think we need to talk about it, obviously not in the press or whatever. We had 4 suicides on campus this year, this academic, that we know of. That is a huge number. We're not, none of them were in nursing that, again, we're aware of. The last one that we had, the family have spoken up really publicly about the fact that they lost their son to suicide, and that there were issues at the university that impacted that, and they were just very public, both at the funeral and the obituary and so on. And we, and Debbie and I have talked about this, this was a really courageous thing to do, but it has really made a difference in how we support the friends of that student, but also in terms of how our community is talking about suicide. So very courageous, very brave, very devastating, but a really important factor in the work that we're doing to reduce stigma.
Well, I want to thank you both for joining us today.